2022 is the year of the 5-star plan.
While some things did change for 2022, the fundamental tenets of the star ratings remain the same.
Good morning, insurance agents of the senior market. Welcome back to Near and Far. It is Friday, November 19th. So, viewers of the show, you are very well aware that 2022 is the year of the 5-star plan. Like, we've had many years before. We've had 2018, 2019, 2021, but 2022, without question, is the year of the 5-star product. And the explosion of available 5-star MA product is just nuts. Like, it's been wild. You've seen our YouTube videos about it. It's just off the charts. So really lucky to be joined today by someone incredibly qualified to talk about what's been happening and, more importantly, what all of it means. So joined today by Bill Rayball, who is the Vice President of Government Quality for Highmark Blue Cross Blue Shield. That's a pretty exciting title, like government quality.
Government quality, yeah.
I'm glad that you're not in charge of government quality for the United States government, because that's something that could make your hair fall out and turn gray. Like being
a little bit broader of scope, right?
Yeah, but so with no further ado, let's get into talking about the meat of what's happening in the market and with Highmark specifically for 2022. So Bill, can you explain to our agents what changed with how CMS figured out MA star ratings for 2022? Because we've gone from an environment where we had a very small number of vertically integrated Medicare Advantage products that had a 5-star rating. And now we've got 3 times the number of plans. It's regional carriers, it's national carriers. I mean, we've got, I think, 4 separate carriers in the state of Pennsylvania with 5-star MA wall-to-wall. What happened differently for 2022?
Sure. Well, first of all, Bill, thanks for having me. I'm
absolutely
really excited to talk about this today. I think first and foremost, a couple things to remember. While some things did change for 2022, the fundamental tenets of the star ratings remain the same. CMS is still rating plans based on an objective set of quality metrics, focusing on chronic care management, preventative care, drug adherence, patient experience, member experience, things like that. And all of that, those elements still remain the same. What happened, though, this year is obviously when we were looking at the impacts of COVID at the height of the pandemic last year, we were all sort of wondering what the impact was going to be on quality ratings as, we had government lockdowns and patients not able to get out and get care in person. So what CMS did was they instituted this policy that they have. Fortunately, CMS has contingency plans for this called the Extreme and Unusual Circumstance Policy.
It's hard to imagine CMS being flexible. Like as a sales guy, I think about CMS and there is zero flexibility to them. But what I'm hearing, you're about ready to say CMS was flexible.
They made some changes, and without getting into the mechanics of it, essentially what they did was this: they continued to rate plans as normal last year, where every measure gets a star rating. So every, whether it's a cancer screening or a satisfaction of the plan, you got a star rating. And then they applied a better of logic. So they looked at how plans did this year, and then they compared it to last year, and whatever score was higher, that's what they got. They recalculated the scores. Obviously, that created a bit of an impact on the overall rating, and that's why for this one-time year, we're getting a few more 5-star rated plans in the marketplace.
Yeah. Well, it was interesting because I'd had a couple carriers who tried to explain that to me as I was posing these questions to say, hey, how is it that we go from here to here in terms of availability of 5-star product, just on the contract level, not even the counties. I mean, you think about the counties that are available, and it's a much bigger difference in terms of availability. And they had talked through that best of logic with me. And I had a really interesting conversation with an agency principal that is not in Pennsylvania, is in another state. And they had said, so it's all smoke and mirrors. And I actually heard that feedback, and I'd be interested how you would answer that question, because the way that I answered it was, they did use best of between 2 different years of looking at data, but they still had to be good enough. Like, it's not like, everyone got just like a, 5% bump on everything. Like, if your best of data was still average to mediocre, you weren't just getting a 5-star plan.
Right. And, we're still being judged amongst each other, right? Yeah. Stars is graded on an industry curve. So it's not like you're rated against some artificial static threshold. It's how you're performing relative to the entire industry, whether that's locally in your backyard or nationwide. So there is still a good objective comparison among the entire MA industry to understand who is firing on all cylinders and where the improvement opportunities lie. And I can tell you too, Bill, from Highmark's perspective, we focus heavily on patient experience and having a dialogue with our members and with our provider network to ensure that the tenets of the star rating system throughout the pandemic was to minimize that disruption as best as possible. And when you look at Highmark did very well in our own right, even prior to the better of layer being addressed, our scores were very strong. We're very proud of that.
Yeah. Well, I can remember a point in time a number of years ago, and it may have been 4 or 5 years ago, that Highmark was struggling from a star ratings perspective. Like, I can remember when there was some massive disruption going on there, and it has been a steady progression year over year over year of getting from 3.5 to 4, yep. 4 to 4.5, and now 4.5 to 5, which is a bunch of work by a lot of people that you oversee. But obviously, all of these plans didn't just get a 5-star rating through creative math. Like that's not what happened. Not like the agency principal saying smoke and mirrors. And there's so much effort, as I said, getting to building your star ratings, on a contract by contract basis. So in looking at how Highmark progressed from 21 to 22, where is it that Highmark saw the most significant gains in terms of those elements that comprise the star ratings?
Certainly. So I think a couple of things. Number one, Highmark performed very well in our patient satisfaction, patient experience measures, the CAP survey. We saw some of the highest ratings we've ever recorded, really across the board, across all of our regions. In addition to that, we scored very well in health plan operations, things like appeals processing. Everything with stars is MA beneficiary centric. Yep. It's always looking out for the member. So whether it is the satisfaction surveys or nuts and bolts health plan operation, it still comes back to the member. We perform very well there. I'd also say on our drug side, things like medication adherence still saw improvements despite all of the disruption from the pandemic. So those were the main drivers and in driving the score up above 5 ultimately.
Yeah, and some of those items had to be really hard to execute on during a pandemic environment. One of the interesting conversations I had with another carrier representative was talking about how telehealth was impacting some of that information data collection. Sure. That play into stars rating. That it was just a totally different environment. And that probably impacted CMS looking at best of as opposed to one plan year as well.
Sure, and a word on telehealth. One of the things that we were very deliberate on was communicating with our members and with our providers around what telehealth could and could not do for purposes of quality. Obviously, there are some elements of quality that cannot be done virtually. Yeah. So ensuring that we're being proactive, forthright, and clear around what the calls to action are, that obviously manifested in strong scores because there was nothing left for interpretation.
Yeah,
and absolutely. We were able to leverage the telehealth medium in order to drive continued dialogue that enabled conversations with the providers and then triggered those follow-up in-person actions when the doctor and the patient felt safe enough to do it as we kind of came out of the pandemic.
Well, I think there's a lot of unseen blessings that have come out of the pandemic. One of which is we finally got our agents to buy into electronic enrollment. That's one of them we've talked about a number of times on the show. Telehealth is one as well. As much as I'm technologically inclined, I had never done a telehealth visit before, and because of COVID, I was inclined to try it. In fact, got my parents to try it. My parents were not FaceTimers or Skypers like before that. All they could do to interact with us was via FaceTime, and now I've got my mom and dad doing telehealth appointments.
Absolutely, yeah.
So, a lot of times those hidden blessings, you got to look for them.
Absolutely. Yeah, we were excited to explore those new areas last year and provide, really, and it kind of comes to Highmark's mission and vision is meeting members where they are.
Yeah. No, that's great. So let's talk about our agents specifically. So I know, and I'm just being super forthright here, many agents are inclined to ignore MA star ratings. And what they're focused on are individual plan items, premium, co-pays, co-insurance, drug formulary, like that type of stuff. So if you're talking to our agents right now, which you are, so should agents prioritize star ratings in the sales process? And if so, why should that be on an equal footing with premiums and co-pays and things of that nature?
Sure. I'd say a couple of things. Obviously, it goes without saying, premiums, co-pays, overall value of the plan. Certainly, those are critical factors in the decision-making process for a consumer to buy. But the one thing that star ratings really hones in on, and I talked about this earlier, it's member-centric. It talks about the overall experience that a member has with those things, whether it is through their provider network, whether it is with the plan directly, whether it is, in terms of the overall perceived value that they have in that plan. And, the star rating program is an objective tool to rate plans among themselves and show which ones have the members that view the plan favorably, and which ones, maybe there are some room for improvement. So if we're looking on that experiential level, which you look at any market, customer experience is only taking on more and more of a factor in the purchasing process. Having that objective rubric to gauge and have truly consultative conversations with clients, I think is a very powerful tool.
Yeah. So I'm going to give you an analogy and tell me if you like this or not. All right. So I was having a conversation with an agent about star ratings very recently, since all of this insanity has happened, and I still think it's insanity. Just looking at the explosion of product everywhere. The analogy I gave them was, okay, if you're on Uber, you pull out your phone, you're trying to get a ride, and both rides cost the same from where you are to where you're going, and one Uber driver has a 5-star rating and the other has a 4. Who are you going to pick?
Yeah.
Okay. Then I followed that up and I said, okay, let's envision that the Uber ride with the 5-star driver costs $25 and the ride with the 4-star driver costs $20. Is there a threshold? And that's how we started talking about it, is if you know going in what your experience is likely to be, what's that worth to you in terms of dollar amount? And it's hard to quantify that, but that was the way that I kind of explained to this agent, yeah, star ratings have to be part of the factor, because at the end of the day, the hardest thing to do as an agent is acquire a new piece of business. So if star ratings are telling you about member satisfaction, member experience, it's almost giving you a predetermined look at how will this carrier support my retention.
Exactly. And the other thing to mention about star ratings is the ratings themselves, they're very broad. They cover a variety of different areas. And when you look at the way it's calculated, you can't game the system, so to speak. You can't run up the score in clinical gap closure and fail on customer experience.
So you have to be. It's not like beating a MAC team by 70 and hoping that gets you in the college football playoff.
Exactly. You have to be firing on all cylinders. So what that tells the prospective client is, look, this plan, if they're a 5-star rated plan, a 4.5-star rated plan, that tells the client that this plan is really focused on the entire spectrum of quality and the entire patient experience. And then when you look at that, and if it's one of the plans like Highmark's that has been 4, 4.5, now 5 for 8 consecutive years, that says that quality is central to the strategy, and the quality is improving because we're graded on a curve. And guess what? The curve rises each year. It gets harder to achieve 4.5, 5 stars. So not only are we staying ahead of the industry, we're getting better.
Yeah, absolutely. So I'm sure that at various points in your career, in being the vice president of government quality, I love saying that. I'm sure that when you laid to bed at night and you dreamed about the day that Highmark achieved a 5-star rating on your Medicare Advantage portfolio, you probably never envisioned that when that day came, that there would be multiple other carriers all over the state at 5 stars as well. So do you feel that changes anything in terms of the marketing impact, or do you think that all of those messages kind of support each other in creating buzz to build consumer awareness of what's this 5-star thing all about?
Sure. I think certainly there's going to be buzz this year. There already is. This is a unique year, and it's generating a lot of conversation. So, and certainly Highmark, we're very proud of that 5-star rating, and we're
as you should be,
and we're excited to showcase.
It's a great accomplishment.
Yeah, but I think as we look forward, it certainly opens up opportunities. When we're looking at potential consumers, providing that consultative discussion to really potentially, if you're talking with your brokers and potential clients around, look, that might be an opportunity to win back somebody that might have been lured away a few years ago. Opens up doors for new customers, and frankly, when you're having those conversations, it enables them to be, like I said, truly consultative, to say this is what it means, and this is why it matters, and this is how to kind of cut through the rating to understand the drivers behind it, which really adds value to the consumer. And and I think when a Highmark plan is up there, we're confident that we can stand with the rest, and we're confident we'll be at the top of the list.
Yeah, well, and I would tell you that of all the insurance companies that we represent that give us information about retention, and not every company is kind of able to do that, but of every company that gives us that retention data in terms of our agents and their book of business, Highmark has consistently had the best retention of anyone that we've worked with. Like, even in years where there's provider noise and like different things going on, we're at the 96, 97, 98%. Yeah. This year, I think we're running at like 99% retention, like already through this point in the AEP. So, I think that message about quality, delivery, and patient experience is really pertinent. My thought on the multiple 5-star plans in Pennsylvania, because Pennsylvania is unique in that you've got so many carriers all over the state with 5-star rating. Like other places, it's kind of a mixed bag. Like in states like Florida, for example, Florida's got a lot of 5-star product that's available this year, but it may be that United Healthcare has got some counties here in the Miami-Dade, and Cigna has it in certain areas, but not others. So certain states are spotted that way differently. Pennsylvania's wall to wall. I really feel like this all creates buzz that gets the consumer to say, what is this all about? Call their agent and say, I want to understand what's happening. Sure. Because if we look at an example like potentially with a disruption factor, provider noise going on, different things, anything that kind of gets that consumer to say, I want to know more about this, even if they don't end up switching, is good. And I think all of these messages build on each other, because if it's just one carrier advertising, maybe you miss it, maybe you're getting a beer during the football game, you're getting a cup of coffee during Price is Right, like whatever it is, you miss that message. But if you're getting hit with multiple messages, you're gonna wake up and take notice.
Yeah, and it's important because consumers are getting more savvy, consumers are more aware, and and it's important for us to be explaining what they can expect as an MA member.
Yeah, absolutely. So CMS has already talked about changes to how star ratings are going to be computed moving forward, about weighting things differently or moving things around. So 2023, I know we're not even in 2022 yet, but
with stars, you're always in the future. You're always thinking ahead.
well, here at Near and Far, we always have our glasses on where we're trying to look deep into the future. So 2023 could look a lot different than 2022. Yeah. So if you could just explain to our agents, what factors are changing for 2023, and what are the things that you and your team are working on, Bill, to kind of maintain that 5-star rating, for Medicare Advantage moving forward?
Yeah. So I think first off, we talked about the better of logic and that COVID driven methodology change. So that was a one-time change. CMS has not signaled any COVID related changes. So that I think that will have an impact overall on the industry. But beyond that, because from our perspective, we need to be successful regardless of the structure. Beyond that, CMS has made some changes in terms of you mentioned the mix of weighting, placing an even more more emphasis on patient satisfaction, patient experience, and operations. So when you look at things like members' perception of the health plan, customer service, appeals processing, things like that, that's going to take on a larger share of the overall star rating. So certainly that's a key focus of ours. But as I mentioned before, you can't just run up the score in one segment of stars and totally ignore the other. You really have to be focused on all areas. And certainly as the industry continues to focus more in quality, both on the clinical side and the experiential side, that's where our strategy lies.
So what I'm hearing you say is Highmark will be rated 5.5 stars for 2023. Is that your bold prediction?
If CMS had a 5.5 star rating, we would be shooting for it.
I love it. So glad to be joined today by Bill Rayball, Vice President, Government Quality from Highmark Blue Cross Blue Shield. This has been a great morning. Thank you so much.
Thanks for having me. Always great to talk stars.
Yeah, absolutely. So we will be back with you on Monday, November 22nd, bright and early at 7 a.m. This has been Bill. I am also Bill, and this has been Near and Far. We'll see you on Monday.